Hello, I'm Lori Taylor. I am a BSN student with Grand Canyon University, and I'm doing a interview with Lee Gill. She's a community and public health nurse for Lafayette County. And I'm going to start out this interview by just having her sign an agreement. That we had talked about just prior to starting. Lee, tell us a little bit about you, where your education lies.
Okay. I have been, this is my 38th year in public health, so I'll give this a little thought to go back. I originally was a 3-year diploma grad and went back to school. I went to La Crosse and then to Mount Scenario to get my public health certification and then follow up beyond that. And have worked here at Lafayette County in, originally home care and public health was the definition of the services each nurse provided. But in 1983, we made a change from that. We separated. Half of our nursing staff did home care because we're a licensed reimbursable home care agency, Medicare certified, and the other half did public health. And that's the way it stayed since 1983.
This is a county-funded organization, or where do your fundings come from?
The public health component does come from partially tax levy dollars, partially through programs that we have created and generated, and partially through block grants with the state of Wisconsin. For example, we have generated some programmatic types of services, the school contracts. We provide the school nursing and have ever since 1976 here in this county, by virtue of the director at the time approaching school administrators and offering that a nurse from this department would cover all the mandated requirements that the schools have. And those have continued since 1976. Each district, we have 7 districts in the county, currently 6 of those contract with us, anywhere from 3 hours to 6 hours of nursing time a week.
All right. How many communities do you cover in your county seat here?
We service every county, or every community in the county in some capacity, whether it's foot care clinics. Any resident of Lafayette County is entitled to our services. So the home care component reaches every single resident of Lafayette County. Sometimes we're looking on the map to look at the borders of those counties to make sure this isn't another county referral for services versus our county, but we're always serving every resident. And that's the beauty maybe of a county owned facility versus a private. A private could deny services, whereas the community-based county owned program serves all residents no matter what.
Awesome. Are you considered yourself rural here?
Extremely rural. Lafayette County's population as of the last census was around 16,000 people. And as you know, being someone local, we don't even have a stoplight in Lafayette County.
That's right. Do you see different things for rural areas, like higher incidence of chronic illnesses due to, smaller area, like increased blood pressures, increased disease processes, just because they don't have the bigger facilities on board?
No, I can't say that we do. I would think more of the population dense areas would have numerical higher numbers. Per population though, I think what we are able to do in our rural areas is provide more specific and detailed resources. We have a really good healthcare community between a clinic and a hospital and an agency, home care agency and public health agency that are in the same block. And I think our interaction and communications help provide better services. Oftentimes some of those services need to be referred on elsewhere, but I think we bring our varieties of expertise together for the betterment of some of the situations in our county. For example, when the hospital had a health fair, probably about 10 or 15 years ago, we collaborated and we were participating in that. I dressed up as a polyp. We were providing information on the importance of colorectal screening, and the physicians attended, hospital staff, and public health here to really help our communities realize we're all on the same page with this education.
Awesome. What would you say the social dynamics of this community would be?
Social dynamics, for what age group are you asking me?
Just in general. I know we do probably have somewhat of a split population. We probably have a lot of young people and a lot of old people, sort of bipolarly. But
Social dynamics, we are working with a lot of small communities. Our demographics, Darlington and Schellsburg are the only two cities in the whole county. The other municipalities are towns or villages. So we deal with a lot of, I would say, unique community dynamics, because every community has its own specific organizations, welcome wagons, or organizations that nurture family structure, that nurture new people to the community. I find a lot of diversity in each community. And it's often hard to offer one program. Let's say we want to do education on breastfeeding, something we've tried to do. To do that in one location doesn't reach all of our county populations, because some identify more with, they border on the edge of other counties, they identify more with attending programs offered elsewhere. So there's still a lot of work to be done to try to help our county realize that we are on board for all of the county population.
do you feel like you have enough resources in your county?
Resources right at hand. We have primary resources to collaborate, but we have to rely on regional resources for some programs. Another example, if it's okay, I give you some examples.
Please.
I'm the tobacco free Lafayette County coordinator. And back in 2002, when we were initially funded, we had direct funding, which allowed us the liberty to do a lot of hands-on education in all 7 school districts, focusing on educating youth to be peer educators, because I believe children learn better from other children. So we did some really widespread education with tobacco programming. When the state funding changed and regionalized us, we're now part of a 5-county group. So only by a small subcontract am I able to continue doing some of those educational components. So we've had to become more savvy with how we use our time, because there's much less of it, and really target the primary points we want to get across in the community. But we're seeing a lot, especially in public health, of regionalization of programs versus hands-on local, which does decrease those local resources.
Yep. How is your mental health issues handled in your agency here?
Okay. We have a human service agency, which is a separate component of Lafayette County Health. And we do contract, human services contracts with our agency to provide nurses to come in on a weekly basis and set up medications, oversee medication for the CSP clients of Lafayette County. We often also refer individuals. We may have contact with people through the foot care clinics that we offer, foot care, immunization clinics that we do. Our home care staff works very interactively with human services when we are concerned about mental health status. And we've always had great collaboration with the agency working with those clients. But we do not directly provide mental health counseling. That is not a staff member here.
What would you say our ratio is for mental health in this county? Do you think we're average?
For clients that are being seen by,
just
identified?
Identified in the community.
That's a good question, because there's always a need for more identification. We have, per population, a low, I would call it a low ratio compared to other counties, of individuals receiving services that have been identified. Ongoingly, we need to be identifying. And mental health can be chronic conditions, or it can be very emergent. I'll give an example. A few years back, when we experienced a horrendous drought, other areas of the state too, but in Lafayette County, because we're such a huge farming region, I had a conversation with the director at Human Services, encouraging maybe providing some seminars, opportunities for people in our rural area to come and talk about the mental health stress they were going through because of the drought, which directly impacts their economic status and their farming future. So I really think that we always need to be watching for emergent situations.
Do you feel being in a rural community, people are less likely to be open to preventive care?
Absolutely. I think one of the biggest areas we deal with is getting the word out there so people do understand the level of confidentiality that exists. Again, we all know everybody in this county. And helping people maintain anonymity, helping people receive their services, and really understanding that it is held in confidence. I'll even extend that into the school setting, because having worked in every school in this county, I've seen a lot of diversity as I come into a district where maybe students didn't previously know me and now see me as their school nurse. That takes time to develop that trust for students to come with physical or mental health concerns, and it's just a process that we need to work through and help communicate. We don't have a budget for public relations in public health, and sometimes that serves to our detriment because people don't fully understand what prevention is all about. How do you show what never happened?
Mm-hmm.
The outcomes. Recently, just speaking to students at County Government Day, which is juniors in all of our schools, when we came together for the public health component, I used an example of polio as a disease. How many of you students have ever seen polio or know what it is? Not one student raised their hand, but one of the veterans who was helping transport students from speaker to speaker raised his hand, and he said, "Lee, in 1943, my 3 brothers had polio and 1 died." Didn't know that was going to happen, but it was a perfect point to what I was trying to make. And I said, you don't see what public health has prevented because you don't see the outcomes of these diseases with generations currently.
With that being said, I know we have a large Amish community in this area. Are they immunizing their children, or are they not immunizing their children? I know there was concerns, through the school system and stuff when that happened.
It's really interesting, and we as public health have been to several preparations for how do we deal with the Amish, because we are seeing more and more schools in our county. The comparisons that I need to make are that depending on what sect, which is SECT, of Amish, whether they come from Pennsylvania or Indiana or Ohio, determines some of their health practices.
Mm-hmm.
In an adjacent county, the nurses, public health nurses, are routinely going in and making well baby visits. That's not the case here. We do not have home visits occurring very often, and we are not immunizing as other counties are. Very recently, because of the pertussis issues, actually statewide in Wisconsin, we have had some Amish come forward through information that they've received from maybe a midwife or other resources, and we have had a very, very small number let us into the home, and we have immunized a few. It is still a huge obstacle.
Mm-hmm.
But again, we're dealing with a different philosophy with the primary sect of Amish that are residing in Lafayette County.
What do you think is your biggest ethnic group here?
I can easily say this because our 2 cities in Darlington and Schellsburg are seeing the increase in the Hispanic population. We have had to have translation in, for example, Chinese really recently, but Hispanic. When we project our incoming 4K class for 2015-16, we're looking at a 50-50 ratio. And I'm already working with the 2 ELL teachers we have in this particular community in Darlington to prepare how we're going to conduct the screenings for those children, because it's not just the communications with the children, it's with the parents. And we're going to need to have additional screening time for the communication interpretation. I don't speak Spanish, I speak German, which doesn't help me for that population. So we're trying to anticipate now how we will deal with it then, but it's increasing at a much faster rate than I think any agencies had anticipated or prepared for.
What do you think is the most vulnerable population in this community?
Wow, the most vulnerable population. I have to think a minute. I would say our severely low income population. They often don't know how to seek resources or to even ask the question, or there's fear of intimidation. Again, I'm making a presumption here, but sometimes I'll use a WIC clinic, for example, women, infant, children, that we have here, and that's conducted right here at the health department. Sometimes I will say I've been forward with a client and said, are there programs that you don't know about? Let's find out. Let me just review what services are here. We're often finding people that don't know they're WIC eligible. They potentially could be Badger Care eligible, and they don't even know how to seek that out or where to go. So I think we have increasingly worked with populations that don't know who to ask the question to.
I wanted to just ask, is there anybody homeless in our area here in Lafayette County? Do you know of any homeless?
We're aware of homeless. Primarily, I will say, as a school nurse, it becomes something that we key in on. Signs of homelessness is actually something that we review with our teacher in services in the fall. And there are certain cues from children that we look at. Guidance counselors, we work pretty much hand in hand with the guidance counselor. The school nurse and guidance counselor collaborate and really try to identify those at risk. I will say I actually had one scenario that I had some information on. I had some phone calls here at the health department, and I called human services that I referenced earlier to check that out and verify a situation with the family. Working more with families than adult individuals. The adult individuals are much harder to identify because we don't really have necessarily anybody monitoring adults at large.
Yeah.
I'm sure there's some of those that are slipping through our awareness. Can think of one case in 2014, an adult individual that was identified because of some community observation and reports, which actually went into the sheriff's department and then involved human services and the health department. Again, collaboration with agencies.
Exactly.
And an individual was taken in for medical care because of being identified with the risks he was at for being homeless and in inclement weather. Yeah.
I want to talk a little bit about values and beliefs. And we've already talked about cultural groups. Any spiritual differences in this county that you can think of? I know we have a gathering of churches, but
We do. Countywide, we do not. For example, working with the Darlington community as a collective group, there are a couple connections we can make if we want to get information out to churches, even including the Hispanic congregations. There's a couple of those now we've identified. Otherwise, in the smaller communities, it's pretty much reaching out to clergy in each separate facility. Or if we put something, maybe something public health related that we want in church bulletins, we have quite a list that we need to outreach. There isn't a county-wide group of churches, which would be great if we had something like that, but we don't.
do you think the community members here value the promotional efforts that you're going through? Do you feel like your community is embracing that?
I feel like the people that use our services are totally aware of the benefit. Home care and public health. We have some families that say, wow, my family member could not stay in their home if it wasn't for the services you're providing. The people that utilize our clinics, our foot care clinics, for example, that's a public health entity. We may be the only ones looking at some people's feet. There have been situations where we found circulatory problems that we've referred people to podiatrists or contacted the family member to say that your elderly parent or grandparent needs some medical follow-up. Those people definitely appreciate and recognize. But as I referenced earlier about prevention isn't witnessed. So as I mentioned, polio as a disease, the vaccination programs that we do. Recently we did flu vaccine in all 7 school districts. We immunized over 1,000 children for this year's flu vaccine.
That is awesome.
But there's no awareness of that unless we could have PR and put that out there. So,
do you have to spend much time discussing with parents about flu vaccines. You know, I know we see that, you know, people think, oh, I'm not getting the flu vaccine, it gives you the flu, or I always get sick after that. Do you see a lot of that, or?
It's diminished a lot since H1N1, which I believe was 7 years ago. And I think that's about right. We have seen an increase in the percentage of parents and adults that are getting flu vaccine. The difficulty we've had is people understanding the term flu. People want to reference gastrointestinal viruses. Oh, I got the flu anyway. No, you had a gastrointestinal virus. What we are talking about symptomatically with the flu is the fevers, the chills, the upper airway, the bronchial problems. That's an ongoing and has been for all the years I've worked here.
Has been since I've been a nurse as
And
well.
it's, yeah, so education is crucial.
How do you think the community members spend their money? Do you think that,
As a county
as a
at large,
county? Mhm.
okay, this is gonna get a little political. Too many people go outside the county to spend their money. I think it's a minority of us that actually first look within our county for the resources that are here, which if everybody could just see that whole picture and understand how that local economy is so dependent on local people keeping their resources here. We just had a Live Well Lafayette committee, which involves a variety of disciplines, including us, and we talked about the 350 application. We'd like to see every person spend $50 in 3 businesses in the county and see how that would stimulate our county economy. It's a concept that we're working with. We're looking at some ideas of identifying and marketing for local businesses that maybe don't have their name out there. The community service farms, for example, many people don't even know they exist. And we're like, how could we connect those with all the communities at large? So we're working on things like that, but that's truly one of the dilemmas we have is local people going elsewhere outside of Lafayette County to purchase needs.
What would you consider the predominant health problems in Lafayette County?
Well, based on our last data, which the Division of Health publicizes for all 72 counties in the state, we have criteria regarding cancer, colon cancer, people not realizing their need for beginning examination at age 50. There's a lot of lack of follow-through with screenings, breast cancer awareness, breast cancer education, and I have to put tobacco just because I've always been at the forefront and always been the coalition chair, getting the education out, because as the big tobacco companies, as we call it, is manipulating children and creating candy flavored and candy looking and packaging to attract younger people. They need to attract new consumers in order to keep their business alive. So I'm very passionate about tobacco. So I won't elaborate anymore because I could go on. In fact, today we're meeting with the legislative representative in Benton schools, and we have students who are going to discuss why we need to continue tobacco funding. And then we're going to recognize the only pharmacy we have in Lafayette County which does not sell tobacco. So that's a today activity.
It is. Immunization rates, how would you put yourself as a county?
Wow, this is a good question. One of our responsibilities as a level 2 public health department is to annually review the percentage of children immunized by age 2. Ever since October of 2010, the law has changed, 11, the law changed where the private insurances must now have providers giving immunizations. If somebody has a private insurance, they can't come and get them through the health department. And for all those previous years, we've always been the primary administrator of vaccines. We can immunize Badger Care, uninsured and underinsured individuals, but the rest we must send to their physicians. But we are still responsible to make sure all those children are immunized. So it's a little catch-22 situation. We do outreach with, we print out children that are approaching age 2, and we actually do hands-on phone calls, outreach letters to parents to discuss it. We are seeing in some pockets, in some communities, lack of immunization because we still in Wisconsin have that personal conviction waiver, and we are continually educating about vaccines. Our percentages are not, we'd like to hit at least 80%, but we're below that right now. We don't have our data done for this current year yet, but we have a WIC clinic today that we're looking at, and there's probably about 15, 16 children coming, and out of those, a third of them are eligible for vaccines right now. I haven't yet made the phone calls, but I will call those parents to see if they would like us to bring the vaccine and give them today. Because if they're WIC eligible, that means they fit the Badger Care criteria. We know we can give those vaccines.
How about death rates in this county?
I can't quote you the current death, depends on the cause. The way it's broken down with the county rankings depends on the cause of death. We do have, part of our maternal child health block grant this year, one of the other public health nurses is working with the child death review team. This is brand new for Lafayette County to look at, and we're working with the coroner on that, the Memorial Hospital on that, and it's a team that's coming together to look at causes of deaths and potential for prevention. And this is a first year of this grant implementation. Because we are rural, as I mentioned earlier, farming, we do see accidents that occur on the farm, sadly, in a fairly higher percentage than we'd like to see happen. As far as death, we're looking at some of the things I mentioned before with cancer and heart attack and strokes. They would be the primary.
With so many farming and farming jobs, do you see an increase in skin cancer in our area just from the exposure from sun? And
we've not tracked, we've not had a baseline to work with. We'd probably have to start with a baseline. Do we see a lot of skin cancer? Yes. One of the things that was previously done when we had a community health day structure that just changed in the last few years, one of the things we offered was skin assessments. We do work with a lot of people, though, that we're seeing for other reasons, and maybe ask them, what is this lesion on your face? Farmers, it's ears, it's face, it's heads, sometimes exposed arms. A lot of, in the summer we do a lot of education with sunscreen and prevention and covering body parts. We also have something called Rural Safety Day, which I should have mentioned before. 4th and 5th graders in the county, we do it every other year. So we do 2 grade levels, and we do a lot of farm safety and animal safety, chemical safety, and we also talk skin safety. So that's a great question.
Okay. I wanted to cover just a little bit on nutrition. Do you see any indication of like deficiencies like malnutrition? Do you see incidents of obesity in our county? Things like fresh water. Do we have a lot of water issues?
Wow, this is a good one. One of our objectives with the Live Well Lafayette Committee that I just mentioned in a previous question was childhood obesity. That was one of our top 3 priorities that we identified last year as a concern here in Lafayette County. I can specifically take this to the Schellsburg School District because I'm on the school board there and part of a wellness committee. With the laws changing federally in terms of nutrition for school lunches, this is a good example. It's been up and it's been down. We have all kinds of complaints, from inadequacy of nutrition to trying too many new foods, to the servings aren't large enough, and every school district is dealing with that differently. Because of our economic diversity and significant number of people qualifying for free and reduced lunches, in Schellsburg we've been able to offer a free-for-all breakfast. It's kind of a pilot project for the state. There are just a few other schools doing it. And it's encouraged for children to come in and eat breakfast. We have done some reviews and checked with students that never were breakfast eaters before, and it's interesting how from the start of the school year until now we are seeing kids go, wow, I feel better in class and I have more energy, and it's a pilot project, but quite interesting. But the nutrition levels in general, yeah, we see all of our communities, and it doesn't matter rural or urban, I think we see a lot of quick, hurry up fast food. And so we're trying to, with our wellness committee in Shelburne, we're trying to do nutrition education. The health teachers in the schools are also really on board with this and working with the dietary staff in probably each of our schools to encourage more collaboration of how you metabolize foods and burning calories and what burns slower and what doesn't. And so one of our focuses is nutrition education. Yeah.
Exercise and activities, community fitness programs, are there any in place in this facility, in this county? Do we have any, I know, safety issues for like bike riding and things like that for kids?
Well, the police departments do bike safeties in our 2 cities. As I said, we've got 7 school districts, but we've got 2 cities. They are offered. And I believe some of those villages also with their local police do offer classes and education. As far as exercise facilities, we have a really active one here in the county seat. And other communities have tried, but I can think of situations where businesses have opened and it started out gangbusters, just phenomenal, and then have declined. There would be a lack of resources throughout the county, but it's kind of that old adage, you can lead a horse to water, but and
make them drink.
That's kind of a universal thing. I think there are resources there for prevention, but people aren't taking the opportunities.
Environmental safety in the county, what do you feel is like one of our biggest issues here?
Okay, I did not mention that one of our staff people is a contract with environmental health. The individual that works with 5 counties is actually hired proportionately by each of those counties to receive service. We have an environmental health consultant here for part of a day on Tuesdays. Unless there's an emergency issue and an inspection needs to be done or a referral, but we're not the primary county. It's one of the larger counties that is the host, and then we have just a segment of that time. And Troy actually works with such diverse environmental issues. We get calls about, I saw rats coming out of this abandoned building, to situations where we have fleas in a home environment and we're seeing the outcome by bites on children that we see at school, to safety of water. The water program just recently, just this year, is now come down that we have had our public health staff trained to do the privatized wells. Anybody that has a retail service like a campground or a restaurant that has a private well, that we are now charged with doing the inspections and the follow-up and the education with those. And in conjunction with our environmental health consultant, our nurses here in public health also work with those programs. So we are seeing a lot of, there are groundwater issues, there are well cracks, well structures, but in a positive way we are working with those business owners to make corrections and improve those environmental issues. We see a lot of reports about maltreatment of animals in our county. It seems like that we've been involved in several, from small to large animal. Again, collaboration with environmental health, health department, and the sheriff's department sometimes.
Mm-hmm. Mm-hmm. This was something I read about in my book, and I didn't know that public health or community health had much to do with. But do you have any statistics on how much sleep your community is getting, or if there's issues with rest or sleep?
That's not a data that I've ever seen on any of our assessment forms.
Okay.
Not for the population at large, no. Maybe with a teacher in a specific class and a specific health unit, but no, not for the county as a whole.
Do you have any trouble in schools with things like bullying?
Does any school not? But the most difficult thing is the interpretation of bullying. working with guidance counselors, we try to do a lot of education with children. I think it's a term that's thrown out, it's almost an abused term sometimes, because I've been talking with students in a puberty class, for example. I work with 5th and 6th graders, and a student will say, that girl stuck her tongue out at me. I want to report that, I'm being bullied. I think we're working very, very expeditiously in our schools to try to provide education on communications and personal interactions, because we need to redefine and help. Yes, there are issues that happen, sadly, and I've witnessed some of those, of how a student teaches another student, but I've also seen a staff member and a student in schools, and there are continually issues arising. But I think education and improved protocols and policies in schools are definitely something we all need to still work on.
How about special education? Do we still have programs for special education?
Well, I can give examples.
I like that you do give examples.
I met with one of my special education teachers in my elementary school yesterday, because I also mentioned I'm on a school board. And my personal philosophy is that if a special education curriculum has its ducks in order, if all the components are in place to have an IEP that is reasonable expectations and outcomes that can be achieved with students, and that we set our goals and we document well and we carry out everything that we're doing, if special education is done appropriately, then I believe regular education follows. And that's my school board, not my public health nurse philosophy, but I always encourage special ed teachers to include me in IEPs if there's anything with the student's educational outcome that's impacted by health concerns. And over the years, I think that's helped open the eyes of special ed teachers to realize the nurse is an important component. It also helps that one of my children is a cross-categorical special ed teacher, and the first time I sat in with an IEP with her was pretty dynamic for me. So I really, really feel that sometimes the link that we can make with the parents too, because the nurse is often the advocate in between, and we might be that buffer between the parent and the school sometimes. The parent's fearful and the parent's struggling because their child has extra needs.
Exactly.
So I think sometimes that nursing component really, really helps support the bridge that brings the school and the parent together. I've even had some IEPs where the students sat in, and it's a joy for me when that student will look up and go, she's talking about helping me. So that helps me build a relationship with that child too, as someone who's remember I said 3 to 6 hours a week we're in there, but it's all really pulling it together, really. But special ed, we are seeing increased needs in the schools, increased identification of students for a variety of reasons. I can't really put a finger on percentages of any type of diagnoses, but yes, we are seeing more and more students identified.
And you mentioned before that you give a puberty class.
That's one of the programs in our contract with the schools. It's part of the health curriculum, but our schools have always felt the school nurse was the one to help deliver that message for boys and for girls, 5th grade and 6th grade. And it's differently in each school.
Does that also identify things like sexual behavior and that kind of stuff, reproductive?
That probably won't come in till there's a required mandate with the state of Wisconsin for a middle school, which is usually 7th or 8th grade, and then a high school reproductive health class. I also teach Shake and Baby, I should mention that. That's done at middle school level, and that's done at high school level again. And I do that in the 2 districts that I contract in. Some districts it's a health teacher, but the 2 districts I'm in chose to have me take the training and be the one to deliver that program. But I will say in those health classes, as their middle school and high school is more where those questions and concerns come forward for reproductive health, yeah.
Some of the stressors on the community, some like alcohol abuse, drug abuse, how does that fit into your community public health screen?
That's more going to come in with human services. That's more under that directive of protocols that they follow in their screenings. If we would have a home care or a public health client that we're aware is having situations that impact their family, more than likely, then we would refer them to Human Services.
And disaster planning, that's another thing I wanted to touch
Preparedness?
on. Yeah.
Let's see, now, we have been charged with taking the lead in that, public health has. And we, right now, collaborate. We have, we called it BioT, now we call it preparedness, meetings on a regular basis, which is a lot of disciplines. We meet actually at the hospital, and we have representation from our office, the coroner's office, local law enforcement. Our most recent meeting, I invited the superintendent from the largest district here in Darlington to attend, and she said she really appreciated the opportunity to see how we're really pulling things together. We have pretty much opened it up that anybody who's interested may participate. We have people who are volunteers in the community that would be our public information officers if we have any type of an event. And we're pretty proud of the fact that we feel pretty organized. Sometimes there's advantages to being smaller and getting people to the table than there are in larger situations. So yeah, right now the current Ebola, we just had a staff meeting this morning. We have a Tuesday bulletin that comes out and then a Thursday update, that webinar that we try to listen in, or it's archived and we listen into, and our little public health staff tries to keep on top of that all the time. But we have a discussion every week regarding where we're at with emergent issues, not just Ebola, but emergent issues in general. So.
And I know one of the bigger emergent things that does happen here is floods, because we have a river that comes through here and we've been flooded out several times. So.
We're pretty fortunate. We haven't set up a tetanus clinic for quite a few years. I cannot recall the last time we did that, but that would be part of our jump into action and look at organisms in the water and education. And yes, we would be pulling our preparedness team together when that happens again.
I really appreciate this interview today. I've learned a lot about my county. I didn't even know.
Good. You might want to work in public health someday.
I just might. Anything you can think of that you want to add that I didn't ask, or anything that's important to you? Or
well, I'm really trying to think. I think we covered a lot of the aspects of the programs that we do. There's always something new. There's always something changing in public health. I think that's why I've enjoyed this as a career, because on any given day, you may think you know what you're going to do that day, and it may be totally shaken up if we get a call from the state that we've got a positive pertussis. We drop everything and we work on that, because we're trying to prevent the spread of any type of public health emergent issue. So,
one of the things I was going to ask you was all your preventive clinics, but I think you gave me a great oversight just going through some of the things that you include on your community as you went through. So.
I appreciate the chance to just share how we work in a rural area, because it is so different from other populations.
I think it is. I think one of the things you identified earlier is confidentiality in this area, because you know, I know you, I've known your husband, I know your kids, and you know, that goes through this whole community. So it is hard to keep confidentiality at bay, I think.
Yeah, and I think just by example has been our best public relations effort in that. Even working with students in the school, when you are working confidentially with a student, and then a few months later they'll come back and say, I want a friend to come and talk to you, because nothing happened after that was taken care of, the students' needs were met, and there was no repercussions from anybody. Oh, okay. So we're tested all the time with that.
Trust level.
Absolutely, absolutely.
Well, thank you for meeting with me today.
You're more than welcome.
And I have to let Lee go. She's got a WIC clinic she has to get to, so